So joining us is Dr. Jamie Zuckerman, a clinical psychologist, to kind of talk about these stresses that we're dealing with. And good morning to you.
Good morning. How are you?
I'm doing well. Thank you very much. We appreciate you starting the morning with us. So I kind of started talking about, I mean, there's a lot going on, obviously, but we're trying to get back to some level of normal, whatever that means. How can we start to feel normal again, or, close when we go out socializing?
Sure. So part of this is managing expectations. And, when people say we're going back into this new normal, I caution people with that only because whatever our normal seems to be of late is constantly shifting. So it's important to manage your expectations and try to control as much as you can control amongst the chaos. But really, the biggest thing that I tell people is manage those expectations and know that when we go back out there, we probably aren't going to be able to go back to 100% of our pre-pandemic routine.
Is it normal to feel anxious? I mean, for whatever reason, and we've all been through a lot, but as I start to do more and more things, I find myself just thinking about it a lot and feeling nervous about going into new experiences. Is that normal?
Absolutely normal. So not only is anxiety a normal human emotion that we have to have because at its bare minimum, it keeps us safe. It gives us information about our world. It keeps us motivated. So anxiety is a good thing. When we go through transitions, even if they're good transitions, so, going back out into society, a job promotion, we're going to have anxiety just because transitions are anxiety provoking in themselves. So it's extremely normal. And the other thing is we are in a global pandemic, something we've never experienced before. And if we didn't have anxiety in response to this abnormal situation, then that would be abnormal. So it is completely normal to feel this way.
But with all of that, there are some that just don't seem to feel it. Like, why does it impact some more than others when they break that whole pandemic routine?
So I think this is just your personality, how you deal with adversity in general. I have seen people that were extremely anxious in general prior to the pandemic do pretty well during the pandemic because this isolation and social distancing was easier for them because they could avoid all the things that were making them anxious. Now that we are going back out, those people's anxiety are going way higher, and people that had anxiety during the pandemic that didn't have it prior to, we're seeing their anxiety go down. I think a lot of it has to do with exhaustion from all of this. I think people's need to go back out and socialize is extremely important to them. So it may appear that they're not as anxious, but I do think majority of people have some level of anxiety. Maybe they just don't show it as much as others.
So is there anything we can do to kind of prepare to start to have those interactions again and start talking to people face to face?
Yeah, my biggest thing is take it slow. You want to maintain as much of a schedule as you possibly can while still being safe, and try to slowly implement pre-pandemic things back into your schedule. I think that Zoom and social media in general is here for a little bit longer. So I think people's obligations towards social interactions, they may feel shift a little bit. We may pick and choose who we want to socialize with a little bit differently than prior to the pandemic, and that's okay. People need to accept the fact that they may feel and likely feel uncomfortable for a considerable amount of time. And again, as you said, that's okay to feel that way.
Just don't beat yourself up over it. Take it slow.
That's right. And understand that it's normal. Yeah.
Yeah, right. Thank you very much. We appreciate you.